Hi, everyone. Thank you for being here. I just want to take a quick moment to introduce Dr. Sarah Cody with County Santa Clara Public Health Department. She's here to address the Abajo release earlier about the importance of in-person school and learning. And with that, I will turn it over to Dr. Sarah Cody. And then we will do questions afterwards, and we will call on you for individual questions. Thank you.
Thank you. Good afternoon, everyone. I'm Sarah Cody, and I just have a few comments to make and then am happy to answer questions. Mostly here today, I'm just here to acknowledge that our schools are back in session. Kids are back in school, K through 12, public and private. And of course, this is a time of great celebration and excitement and understandable anxiety, particularly parents of kids who are in elementary school and pre-K and too young to be vaccinated. So I want to acknowledge that the excitement is also mixed with a bit of apprehension. Over the last 18 months during this pandemic, we have learned a lot. And one of the things that we've learned that I and other health officers spoke about several months ago is how important it is for children to be in school for in-person learning. And that during the pandemic, when most children were not in school, we saw a lot of other health harms, including worsening mental health, learning, lags in learning, falling behind academically, and really just lacking all those supports that schools provide, socially, nutritionally, as well as academically. So our task collectively is to ensure that kids are back in school and that we do everything that we can to prevent COVID as much as possible. We have learned a lot during the pandemic. The schools have spent a lot of time preparing, and we know what to do, and we know that we have to layer these things together. So the key principles are vaccination. Anyone and everyone who is eligible, that helps protect those who are not yet vaccinated. Testing, both symptomatic and some surveillance testing, universal masking, particularly indoors, and of course optimizing ventilation and moving things outdoors when possible. And these are all preventative, and when you add them up together, they are quite effective. But even with this, I want to be clear and set expectations. We are going to see cases among students, staff, and teachers. For the most part, these cases are going to reflect what's happening in the school community around. So for in the vast majority of cases, people will probably acquire their infection outside of the school setting, although they work or study inside of the school setting. But on occasion, we are likely to have some spread in schools as well. The good news is that each school has a plan for what to do when there's a case to implement these prevention strategies and prevent outbreaks, and that's what schools are doing. But the idea is trying to maintain a balance to enable kids to get all the benefits of in-person learning while we try to prevent COVID to the greatest degree that we can. So there are things that all of us can do to support schools and in-person learning. One is vaccination, so that everyone around, for example, an elementary school age child not yet able to be vaccinated, if the older siblings are vaccinated, the parents are vaccinated, the aunties and uncles are vaccinated, and the school staff are vaccinated, that's going to add protection for that child, and that's something that we can all do. We can all model and teach our kids to wear their masks consistently when they're outside the household and when they're at school. And I think it's also important for families to understand that it's possible that one of their kids may test positive for COVID, and for families to make a plan that when the child tests positive, they're going to need, obviously, to be home. So those are some of the things that we can do to support families, kids, and schools, and keep in-person learning and all of its benefits. Thank you.
Now we'll take questions. First question, CBS.
Oh, hi, KCBS, Marty. You may have just heard in the last half hour, Oakland has announced that 100 students and teachers have COVID, 7 classrooms have been closed, and those people, everybody's been quarantined. My question is related to the testing. What triggers the testing? What's the right amount of testing and the timing of the testing that should happen in the event of something like this? Or anytime?
Yeah. We're following the California Department of Public Health guidelines for K through 12 schools, as well as testing. And very briefly, if there's people who are exposed to a case need to get tested, and there's a particular a cadence for that. And that's sort of like like response-driven testing. And certainly anyone who develops symptoms should be tested regardless of their vaccination status. But the short answer is we're following the CDPH guidance, and our schools are following the CDPH guidance.
Don't see a lot of hands up. One more question out there? We're good. Thank you very much.
Hold on. I got one. Dave, channel 2. As we've seen this past Tuesday at City Hall, anti-vaxxers, anti-mask, obviously these people aren't going to get their kids vaccinated, and those kids are going to school. What is there something to put in place to, try to reach those people, or to have them realize that everybody needs to be vaccinated?
So as I mentioned, there's not a single intervention that's going to protect everyone in its layers. So it's vaccination, it's masking, it's regular testing, it's ventilation, it's staying home when you're sick, et cetera, et cetera. So in those instances where someone is eligible to be vaccinated but isn't vaccinated or isn't yet eligible, then we depend on those other strategies. And we also depend on high vaccination rates in the community at large. Santa Clara County, as you may know, is extremely well vaccinated as compared to many other jurisdictions. We have 81% of people eligible for COVID vaccine are fully vaccinated, 81% fully vaccinated, which is quite extraordinary and helps to protect those who are not vaccinated.
KGO?
Can you update us on how Delta's doing in Santa Clara County with highly vaccinated? So we are so highly vaccinated. Has it had an impact on us? How much of an impact?
Yeah, so the predominant strain circulating here in the state and in the country is the Delta variant. The Delta variant is much more transmissible. That is, it spreads much more easily. And even people who are vaccinated can become infected and can spread. With the other variants, those of us vaccinated, really very unlikely to spread. So that's a significant difference with Delta. The key thing to remember, though, is that the more people that are vaccinated, it helps really slow things down. So think about a high-speed train, right? It's not like if you reach top speed, you can brake and then absolutely come to a stop. But the high vaccination rates allow us to slow the train way, way, way down, even with Delta circulating.
All right, thank you, everyone.
Just
We'll wrap up. Take one more off.
Okay, I'm just kind of taking it back to the schools related to the Delta. How many people 18 and under are sick right now in Santa Clara County?
So schools report to us. They report both single cases among students, staff, or teachers, as well as clusters. And then our schools team goes to investigate. And what we're really looking for is this a case of transmission that occurred in the school, or is this a case, just a number of cases that simply reflect the community? For example, the staff, teacher, or student got it at a household event, a social event, in the community, or what have you. And for the most part, what we're seeing now is these sporadic cases, onesies, twosies, and we've not as yet documented any outbreaks with spread in school. But I want to underline what I said before, which is that it will happen. It's a matter of time. It will happen. And the good thing to know is that schools have plans in place. They've been working very closely on their plans to catch it early and prevent further spread. Thank you.
Thank you, everyone.